Good evening, everybody. Thank you for joining me on Monday night. It's a very, very warm evening in Melbourne, and what we're going to be discussing tonight is comprehensive orthodontic training for short-term orthodontics, and we're going to discuss all about Smilefast. So, I'm just having a few little computer issues. Okay, so who am I? Some of you may know me. I'm Dr. Jeffrey Hall. I'm a specialist orthodontist here in Caulfield, Victoria. And just to let you know a little bit about myself, I'm an orthodontist here in Melbourne, as I've just mentioned. I became a diplomate of the American Board of Orthodontics between 2005 and 2010. I did my undergraduate training in dentistry back at Melbourne University in 1983, and in 1990 I completed my orthodontic degree at the University of Pennsylvania in the United States, and I came first in my class. And I don't say that for any arrogance whatsoever, because if you notice, I haven't said where I came in 1983 at Melbourne University, probably because I came 49th out of 50 in my class. And the point that I'm trying to make to you is that anyone can do orthodontics. Orthodontics is very, very easy in 80% of cases. It is very straightforward. And this is what Smilefast is all about. It's going to teach you how to do those 80% of patients. But a bit more of a background of me. I've been very involved in a lot of continuing education for general dentistry and also for orthodontics in the past. I'm a member of the American Society of Orthodontists, obviously a member of the Australian Society of Orthodontists, I've set up the Australasian Lingual Orthodontic Association, I set up the Australasian Orthodontic Study Club, and for some of you who may have heard of the Seattle Study Club, I founded that in Australia. I also founded the New Horizons Study Club, which is very well known here in Melbourne. I was also the first person to be doing Invisalign outside of America back in I think it was back in 1999. So people ask me, what is Smilefast? And what we're going to talk about tonight is, firstly, what is Smilefast? Why do you need Smilefast in your practice? What are the benefits of Smilefast to your patients? What are the benefits of Smilefast to yourself in your practice? And then, why do I believe that Smilefast is so superior to other systems that you have been inundated with via email blasters, etc., etc.? And then to explain to you what our Smilefast Pro course is all about. So what is Smilefast? Well, it's the most efficient and predictable cosmetic orthodontic solution. It provides patients with significant improvement in dental alignment in a very short period of time. And Smilefast allows for this cosmetic correction of the front teeth without occlusal damage. Basically, we are avoiding changing the occlusal scheme posteriorly, but we want to improve the cosmetic correction of the front teeth. Our goal with Smilefast is not a skeletal or occlusal perfection, but to provide the patient with a great smile, natural smile, in a short period of time. And because it's faster and more affordable, it actually means more patients for you. And the question is, why do you need Smilefast in your practice? Because Smilefast gives patients what they want. And what patients want are straight teeth and a beautiful smile. Very few patients come into your practice today, I'm sure, and say, please doctor, could I have a root canal treatment on my upper right first molar? Or can you put an implant in? They're coming to you because they want nice straight teeth and a beautiful smile. If I took away your cosmetic dentistry, your veneers, your crowns, your bleaching, I ask you, how many patients would you have in your practice? And then I'd ask you the question, how many good quality patients would you have in your practice? And how many patients would you enjoy treating? Because I think most of us get a lot of pleasure out of providing patients with great smiles. So the question is, what do patients need, or what do patients want? Well, we know that every patient needs healthy functioning teeth. That's why we do dentistry. We're providing them with healthy functioning teeth. But as I said before, very few patients are going to come into your practice and say, "Doctor, please give me a perfect class 1 occlusion. Give me a mutually protected occlusion." What they really want is straight teeth and a beautiful smile. And what these adult patients want is they want this done quickly and efficiently. And Smilefast meets this demand, and I can honestly tell you it will build your practice. Our clients who've never done orthodontic treatment previously, they're starting 50 to 100 patients a year now. And they're driving in all these other patients for their cosmetic dental needs as well. So why should you be offering Smilefast in your practice? Because Smilefast is a technique which is a 6 to 9 month procedure that I can guarantee you patients want. And we all know patients will always find a way to pay for what they want. Whether it be for a new car, whether it be for a new mobile phone, or more importantly, in our situation, they'll pay to have straight teeth and a nice smile. And this will then drive more cosmetically oriented patients into your practice. And we all know that these are the best quality patients for you. It's going to dramatically increase your new patient flow. As a result of that, obviously your orthodontic starts, which you're probably not doing many of at the moment. And as a byproduct, your general dentistry procedures, be it your scale and cleans, your bleaching, your composite fillings, your veneers, etc., and your cosmetic dentistry procedures. So at the end of the day, it's going to increase every part of your practice. And by increasing your practice, it's going to build your business. And you can build your business in many different ways. As we've already mentioned, it's going to drive more cosmetically oriented patients into your practice. And at the end of the day, if you want to build your business, you want to reduce and delegate your unprofitable procedures, such as your cleanings of teeth. You delegate those to your hygienist, or you delegate those to an assistant dentist. And the beautiful thing about Smilefast is you can delegate 95% of the Smilefast orthodontic procedures to a hygienist, therapist, or even a new graduate dentist. It is so easy, and we will teach each and every one of you in the practice to be able to do the necessary procedures to make sure the patients are treated in the most efficient manner. Smilefast has a very good hourly rate, and as such, it will increase your hourly profitability. It's on the same level as your crown and bridge work and veneers. So it will increase your hourly profitability, it will increase your gross income, and obviously your net income, and then also, because what you're doing is giving patients what they want, a great smile in a short period of time, you will achieve greater satisfaction in your dental practice, which I believe is very important as you get older in the dental profession. So Smilefast is the treatment patients want and the benefits that I believe you as dentists are looking for. It's a complete system from first contact, the initial patient exam, even the marketing of driving patients to your practice, to fee presentation, to bracket placement, to the monthly adjustment visits, and to what we call deband and retention. We will go through the complete system with you in our Smilefast Pro course. And we will support you for each and every part of that process, for each and every patient. What you have to also understand, though, is Smilefast is purely for adults and primarily for cosmetic treatment. And I say that, and I'll explain this more to you in the Smilefast Pro course, but I say that to you as with a child, we want to provide them with a perfect occlusion. But the adults have come in and they want a very quick fix improvement in their dental alignment. So my principle is make sure we do more good than harm, and that we do not change or alter their occlusal scheme, but look at improving their anterior alignment. And if you compare Smilefast with the other competitors in the aesthetic market, so let's look at Smilefast and then look at the aligners. So aligner systems have a digital setup. They don't do obviously indirect bonding. They're not as accurate as Smilefast. They're much, much slower than Smilefast. Some of them have an online portal, but they don't provide you with any support and help of how to treat the case, where Smilefast will be there to provide you with online support and one-on-one support. We are only a phone call away to make sure that each patient is treated in the most efficient manner. And at the end of the day, and I can prove this to you, Smilefast is probably 3 times as profitable from an hourly basis than any aligner system. And why? Because it's more accurate and it's faster. And the laboratory fee is far cheaper. And it's far more predictable. So when you compare Smilefast to veneers, veneers are very accurate. We know that. They're quite fast, but they don't really provide you with much support. You go ahead and cut the teeth and you just hope for the best. You need to do a lot of training. Their veneers are also as profitable as Smilefast, but the biggest factor is Smilefast, because it's an orthodontic procedure, provides you with a non-destructive dentistry. We maintain the enamel. And I think each and every one of us who are dentists feel that the best type of dentistry is minimal dentistry. And that's the big advantage of Smilefast or an orthodontic solution over veneers. It is a non-destructive process. So the issues with other cosmetic treatments, aligners, they take a long time in treatment. There are lots of visits, they're expensive, and the movements are very unpredictable. And patients complain that they don't get the results that they anticipated. Veneers, they're very invasive, they're costly, and even veneers are not permanent. They need to be maintained over a period of time. Traditional braces treatment. Normally, most of them lack digital accuracy, and they're too long in treatment. Adult patients don't want to spend 2 years in braces. And then you've got bonded composite resin, which is not really natural, not permanent. They discolor. It's a cheaper option than veneers, but at the end of the day, if you can align patients' teeth in 6 to 9 months like you can with Smilefast, patients will choose that 90% of the time. And I've done a survey in our practice, and I can assure you 90% of patients will take the Smilefast approach over a 2-year orthodontic treatment plan or even an aligner treatment. So let's have a look at cases that can be treated routinely after a 2-day Smilefast course. So you've got patients who are crowded with a deep bite and 6 months of treatment. And what I want you to do as you look at all of these cases, ask yourself the question, if you didn't have an orthodontic alternative in aligning the teeth, how would you resolve this patient's aesthetics requirements in a biological and ethical way? In other words, if this patient was a member of your family, be it your wife, your husband, your child, would you want to be cutting these teeth back and doing veneers to provide them with a cosmetic result? And I would say no. So look at each case and ask yourself that question. This patient here, we've got a very deep bite, 6 months of treatment with Smilefast. Rotations, how would you go ahead and align the upper right lateral incisor without devitalizing that tooth? So you've got some mild rotations for this patient, 5 months of treatment. Uneven gingival margins due to over-eruption of the upper anterior teeth due to bruxism and wear. And we've intruded the anterior teeth and built up the incisal edges with composite. So we've intruded the anterior teeth, to level the gingival margins, and then we've been able to build up the incisal edges with composite. So a little bit of spacing and some rotations, 5 months of treatment. Would you prefer to be doing this for your patients than going ahead and doing 6 veneers? Bearing in mind if this patient was a member of your family. And you've got the opportunity of just doing 1 arch treatment. So here we are with a patient we've just done just purely upper arch treatment to improve the appearance of the upper anterior teeth. And yes, they still will need 1 veneer on the upper left central incisor tooth because of the colour. But that's very minimal dentistry. Patients with severe crowding of the upper and lower teeth in 8 months of treatment. And you can't put veneers on the lower anterior teeth. And there's a fallacy in life that people say, I'm only worried about my upper teeth. But as we grow older, the lower teeth become more visible with age. So that's what we're finding in our practice is the 40, 50, even 60-year-old patients are coming in wanting their lower teeth to be corrected. And you cannot do that with any type of veneers or restorative dentistry in a good biological way. So significant crowding with a deep bite, 9 months of treatment. These are all very predictable results. Severe crowding the lower arch, and as I just said before, a lot of adult patients are coming in for lower anterior treatment. And we have severe crowding. This can be corrected in 7 months with all the techniques that we will teach you. Crowding of the upper and lower teeth, 9 months of treatment. And I've got hundreds of these cases. Spacing in the upper teeth, treatment in 7 months. Upper and lower treatment, severe crowding in 10 months. So the benefits of Smilefast to the patients are very obvious. The benefits to the practice, well, obviously we want to be profitable. And to give you an idea, the total amount of chairside time for a Smilefast case is about 5.5 hours. And that's if you, as the dentist, is doing everything. But 95% of this could be delegated. So in fact, if you had a hygienist or another dentist, your chairside time would be more like 30 minutes, and the rest of that time would be delegated to your auxiliary. So you've got 7 to 10 patient appointments, approximately 3 to 5 hours of total chairside time, but 1 hour maximum of dentist time, with 6 to 9 months average treatment time. So if you're charging out a fee of about $6,500 for Smilefast, and all your materials and your lab work costs you about $1,500, you're making $5,000 profit over a 5-hour time period. So your production per hour is about $1,181 per hour. Or if you want to look at it after costs, after your $1,500 worth of laboratory costs, materials, etc., you are making $909 per hour. And I asked you the question, would you be happy if you were making $900 per hour after all your laboratory fees, etc., if you were doing veneers? I think you'd find you'd be very happy with that. When you compare it to aligner treatment, and we've done all the figures, Smilefast gives you production of $1,181 per hour. Aligners is $625 per hour. But once you take away all the laboratory costs, etc., Smilefast is $909 per hour, and the aligner treatment is only 1/3 of Smilefast. So you can see the enormous difference here with regards to your production per hour. And basically what we're saying to you is if you just did 2 cases a month of Smilefast, you can earn an extra $7,000 of profit. Not gross income, but of profit. That's an extra $85,000 a year of profit, which I think is not too bad. And that's 2 cases a month. But I'm sure some people in the audience are saying, but I won't have the time to do 2 cases a month. So we figured out how much time would you need to do 2 cases a month. And basically, you would need 14 hours a month of total chair-side time to do that 2 cases a month. So if you work 20 days a month, let's say you work 14 days a month, you need to find 1 hour per day to be able to do your 2 extra cases per month. But that is 14 hours of total time. If you have a hygienist, the hygienist will spend 10 hours of the month and you only need 4 hours of your time. And I'm sure most of you can find 4 hours of time in a month to make an extra $85,000 a year of profit. So we know that we're going to drive more cosmetically oriented patients to your practice. We want you to reduce and delegate unprofitable procedures. We want you to delegate 95% of the Smilefast procedures. We want you to increase your hourly profitability. We want you to obviously increase your gross and net income. And we want you to achieve greater dental satisfaction. So remember, short-term cosmetic orthodontics is not a replacement for comprehensive orthodontics. But adults love this, okay? You still have to provide adults with the ideal treatment option, but trust me, 90% of adults will choose the short-term cosmetic approach. And we go through this in the course with regards to pick the low-lying fruit. So, just to show you a case. So, patient comes in, and we've got some significant crowding of the upper and lower teeth, Class 2, Division 2, and she doesn't like the alignment of her anterior teeth. Well, she went off to 4 orthodontists, and 4 of them said, you're either going to do jaw surgery, you're going to extract teeth, and it's going to take 2 years of treatment. Has that ever happened to you? Where you've referred them off to your friendly orthodontist and they've said jaw surgery or extractions of teeth, and all they want is a cosmetic alignment. So the OPG shows the impacted wisdom teeth. We do a Ceph analysis to aid in our diagnosis, which we talk about. And and when I find, so what Smilefast has, which is unique to any system that's out there, is we have a 3D viewer. We have a portal and a 3D viewer. So we can see where the brackets are going to be placed in the pre-treatment position, and then we can see exactly, exactly where your teeth are going to be in the post-treatment position. So we can look at it in all different views. We can move the teeth around. We can show that we can take the brackets off. We can take the wires off. We can play a video for the patient. We can show a gallery view. But at the end of the day, this is where the brackets are going to be placed in the pre-treatment position to achieve the final result in the post-treatment position. We also have guidelines that we can use. We can move teeth up and down, etc., etc. So there's enormous functionality in this viewer. But at this particular point, you have the ability as the dentist to say, Jeff, I want to extrude that upper right lateral. So you would go in there and provide your notes here, press the revision bar, and then it would come back with the extrusion of the upper right lateral. And at that point, when you're happy with it, you press approve, and we give you the most precise digital indirect bonding setup that is available today. So here we are. This just shows you the images of where the brackets would be placed from our 3D viewer, and what the result would be with the brackets in this position with a straight wire. That's the result that we anticipating to achieve. And you can show this to the patient as well. So before and after, the occlusal view before and after. And we will teach you a whole diagnostic criteria for each and every case. So we make sure that we go through a proper diagnostic criteria for each and every case, so nothing will ever get missed out on. And then we go through a very unique and structured treatment plan for each and every patient. And we will go through that with you in the course. How do you determine what type, whether you're going to treat or not treat, the bracket setup, how we're going to get the space, etc., etc. Means nothing to you tonight, but after 2 days, you will understand everything I'm talking about. So everything is done with our digital indirect bonding solution. So the brackets are placed in the digital world, and then we use these transfer trays to be able to place the brackets in the patient's mouth. But it's done in the digital world. There is no operator error. And that's the key to our technique, or one of our keys to our technique. So the brackets are placed. So all it is basically putting etch on, putting bond on, putting some composite, and holding the tray in place. So the brackets are placed, and then we show you how to put the arch wires in, which will take us all of 5 minutes to teach you. And here we are, day 1 in January 2013, February 2013. And all the teeth are just straightening up. And all I'm doing is putting some wires in and tying the wires in. And it will take us 5 minutes to teach you how to do this. So here we are, 3 months into treatment, 4 months into treatment, 5 months into treatment, and that's the patient finished. Do you think that patient looks better? Do you think that patient's pretty happy with the result? So 6 months into treatment, we were able to take the patient's braces off, and they were ecstatic. So 6 months, and they look fantastic. And anyone can achieve these results. Excuse me. So why is Smilefast superior to other systems? Yeah, you've seen other systems out there. They all advertise. But firstly, I am a trained orthodontist, and I think I'm a very good orthodontist, I might add. And our training will provide you with comprehensive orthodontic training for short-term orthodontics. We want you to know everything that could go wrong, and how to fix it. We want to teach you the principles, because without principles, you will never understand. So our training is a comprehensive orthodontic training for short-term orthodontics. We have a very unique online web-based portal where we will actually be able to provide you with full support, and we assess the cases for you. We will say which cases you can treat, which you can't, done by an orthodontist. We have the unique digital indirect bonding system, which no one else has. So we have an online support from treatment assessment to final removal of braces. We also have one-on-one support where you can call us at any time. Where we have people that come into your practice and help you one-on-one if you so desire. This is an example of our portal where photographs are placed on the portal and we can respond to any queries that you've got. The portal allows a very easy case submission by the doctor. And what we do is we provide a total support system for the doctor, case by case, with the ability to download photos at each visit and ask any questions about the case. And these will be answered by fully trained practitioners and fully overseen by our group of specialist orthodontists, ensuring doctors will learn very quickly and their skill level will be accelerated. There's no software to purchase, as our portal is accessible on any Windows-based computer. The keys to orthodontic treatment is diagnosis, which cases to treat and which not to, bracket placement. So with the diagnosis, we're going to teach you all of that in our 2-day course, but we also have the online portal where we'll make sure that you will not do any cases which are above your experience level. Bracket placement, we will teach you all about that through our digital indirect bonding solution. So you have the most predictable bracket placement tool. And then we will teach you the mechanics of how to deal with each and every case. And there is an 80-20 rule in everything in life, I believe. You can treat 80% of the patients very easily. It's knowing which 20% not to treat. And we're going to make sure that you don't treat those 20% and make sure your life is very easy. They're the ones that you will refer off to your friendly orthodontist. So we're going to provide you with a comprehensive orthodontic training so that you will feel comfortable in this 80-20 rule. And we have the online case submission portal. And this is just an example to show you, yes, we reject cases. If the case is not suitable for Smilefast, we will reject it. I would rather you reject a case and make sure that you will never have a problem. That is our mantra. We want to make sure that every case that you do will be successful. So Smilefast will provide you with the only predictable digital indirect bonding system with local one-on-one support and sound orthodontic training. And we will provide you with comprehensive orthodontic training for short-term orthodontics. And what do we offer? Well, it's a local Australian registered specialist orthodontist. Me will be there for you. We offer online portal support from treatment assessment to final removal of braces. One-on-one support is required. Precise, predictable bracket placement using our unique patent digital indirect bonding system. There is no other system that utilises this. There is no other system that provides you with a comprehensive orthodontic training for short-term orthodontics. I stake my reputation on it. And we're the only short-term system which discusses and utilises cephalometrics. And I can assure you, without this, you are indefensible. And I think you all know that there are orthodontists out there who do not like general practitioners getting involved in orthodontics. So you've got to make sure that you are defensible in every form. And we are the only short-term system which discusses and utilises cephalometrics. Now, when you evaluate other short-term systems, you've got to ask yourself the question, does that system use intraoral or extraoral photographs? Obviously, Smilefast does, but there are many that don't. Does the other systems utilise cephalometrics to confirm the diagnosis or aid in treatment planning? Well, as far as I am aware, Smilefast is the only system that does that. Does the system have orthodontists determining if the case is suitable? There are very few systems that have orthodontists involved in it. Most of them are general dentists. And I can assure you, if something goes wrong, you will have a significant problem. A system where ongoing support is provided by other dentists with minimal experience. Most systems have other dentists providing support, which is wrong because they don't have the experience, they don't have the knowledge. And then, this is what I believe, most systems who do indirect bonding, in fact I know this for a fact, they use a dental technician or some of them even use a person off the street to place the brackets with no idea of the eventual outcome. Would you like your brother or your sister to be placing brackets for you without any knowledge? Well, that's what you're purchasing with most other systems. So, when you compare the Smilefast digital indirect bonding system with any manual bracket bonding, which is what any other system utilises, there is no digital setup, there's no digital indirect bonding, the accuracy is really poor compared to Smilefast, and as a result, the speed of treatment is compromised. Very few of them have an online portal. There's very little support, and as a result, their per hour profit is greatly reduced. So at the end of the day, if you're using a manual bracket bonding procedure by a laboratory technician and you don't know who's putting the brackets on, you have no idea, then I think that is litigious and you do not have any leg to stand on. So ask yourself these questions. If you get into an issue with APRA or a specialist orthodontist, who would you want to be defending you? Who would you like to defend you? Do you want a general dentist based in Singapore? A general dentist from the USA? Do you think they're going to come over and support you? Or an orthodontist from England? I don't think so. It's your choice. I know what I would be choosing. So Smilefast has been designed to ensure the doctor treats only those patients that he will achieve consistent quality outcomes with minimal treatment times, minimal doctor chairside time, maximum profitability, and most importantly, no stress and totally happy patients. What do some of our dentists say about the Smilefast and the Smilefast Pro course? Well, John Pole, I've done a few short-term orthodontic cosmetic courses. Smilefast is the best system without any question. I just want to say what a fantastic system Smilefast is. You guys have been amazing in responding to questions. Smilefast is a first-rate orthodontic course offered by an experienced and knowledgeable orthodontist. All my concerns and questions were answered promptly and clearly, and I look forward to being able to offer my patients this additional and invaluable treatment option in the future. Dr. Hall was kind enough to send me a Smilefast expert, Robin, who shadowed me during my first clinical cases to ensure my patients would get the best possible results. Her insights and recommendations were appreciated by both my staff and my patients. Smilefast is a must for any dentist that wants to provide a high-quality cosmetic dentistry. Even after undertaking many long and short-term orthodontic courses over the years, with Jeff's great teaching, I picked up heaps of great biomechanical tips and tricks that have changed the way I treat my orthodontic patients. The ongoing support provided by Smilefast is invaluable, with most clinical questions answered within the day, giving you confidence in treating your patients because you know that backing is only an email away. From the beginning of the treatment till the end, the Smilefast team have made every step so stress-free. Digital indirect bonding and 3D virtual setup, online case management, and continual education. It can't get any better than this. Thank you, Angie. So if you go onto the www.smilefast.com.au site, there's a whole list of testimonials. Hear what other dentists say. So we're very involved in education. As I said, it's comprehensive orthodontic training for short-term orthodontics. So I know it's getting late, so we'll run through this very quickly. We have the 2-day Smilefast Pro course. And we go through a lot of detail, giving patients what they want, correct diagnosis, key treatment steps, in-depth orthodontic training on orthodontic brackets, arch wires, tooth movement, precise predictable bracket placement with digital indirect bonding. We're going to do bracket placement with direct bonding, management of crowding, spacing, deep overbites and rotations, basically 80% of the orthodontic problems out there. Mastering the tools and technology of short-term orthodontics. We're going to do intensive hands-on training and individual doctor case discussion. We're going to discuss the Smilefast online case management portal and unique patent 3D viewer, support options, patient marketing, payment plans, in-depth troubleshooting. So what we also are going to do is give you 6 hours of pre-course training videos where we're going to give you the basics of orthodontics, a course overview, how to make patients happy, basics of occlusion, correct diagnosis, suitable patients for Smilefast, the perfect new patient exam, obtaining high-quality orthodontic records, how do teeth move, the basics of orthodontic brackets, wires, and ligation, the main orthodontic movements, and a brief rundown on our Smilefast 3D viewer and online portal, debanding and retention, and ongoing case support. So this will be 6 hours of pre-course training videos. And so basically what we're going to be supplying as part of the Smilefast Pro course is the 6-hour online video course, full printed copy of all lecture slides and hands-on course notes, hard copies of written materials, brochures, the before and after album, all of the secure online web-based portal with the help desk, technique videos, clinical guides, protocols, downloadable forms, marketing material for your practice, all the materials for the hands-on course, and obviously the 2-day Smilefast Pro course. Normally, we've been charging $5,600, and this includes 2 free cases for a value of $2,600. So for a $5,600 fee, you actually get an extra value of $5,250 over and above the 2-day Smilefast course. So in essence, what we're going to give you, you're basically paying an extra $350 for the 2-day Smilefast course. But before January 31st, we're going to give you 50% off. So we're going to give you the 2-day Smilefast Pro course, the 6-hour online videos, those same course manuals, before and after book, the portal resources, the marketing material, a typodont with the Smilefast porcelain brackets and tooth tone arch wire, but we're only going to include one free case, $1,300. But for $2,800, you are getting an extra value of $3,950 over and above the 2-day pro course. So for $2,800, you're actually getting $3,950. What you need to do is, if you register for the course on our site, which we'll show you in a second, you need to use the voucher code PRO50, and that voucher code will give you the 50% discount. But that's only available till January 31st. And then we have other courses later, where we have the advanced course as well. And we've got lots of interesting things happening with Smilefast in the future, which I won't bother talking about tonight. But we're developing a new bracket system with probably the world leader Rohit Sachdeva, who's a very good friend of mine. But Rohit was the one who invented copper night eye, and he invented Sure Smile. And so we will have our own unique bracket system for Smilefast, which we're trialing at the moment. And we're going to have a unique indirect bonding tray system as well, and a new aligner system for finishing orthodontic cases. So here are the course dates. We're going to be in Sydney on Thursday and Friday, the 3rd and 4th of March. So if you want to go to the www.smilefast.com.au website, and you can look for the courses, and you apply the voucher code PRO50. So you book now for any of the courses, and you apply the voucher code. We're only going to be in each state once per year. So Sydney, Melbourne, Brisbane, Auckland in New Zealand, and then Adelaide. So when you go to the website, www.smilefast.com.au, on the front banner, there's a register now. You can also go into the courses area and and when you register, you can apply the voucher, PRO50, and you get 50% off your course registration. I know it's been a long night, so just to recap, the 50% off Smilefast Pro, using the PRO50 code, will give you extra value of $3,950 for $2,800. So you've been a very good audience. I thank you very, very much. So I'm going to leave this up on the screen, www.smilefast.com.au. Apply your voucher, PRO50, for your 50% off your course registration. I look forward to seeing you at the course. One of our courses, Sydney, Melbourne, Brisbane, New Zealand, Adelaide. And I can assure you that Smilefast will change your life if you're not doing cosmetic short-term orthodontics. And even if you are, use a system which will provide you with digital, precise bracket placement utilizing digital indirect bonding, and you have our support and you have our quality of training behind you. I can assure you, you will never regret the decision. If you want to contact me, please contact me at jeff@smilefast.com.au. So I'll leave this up on the screen and look forward to hopefully seeing you at one of our courses in 2016. I thank you for your time, and I hope you now get a bit of an understanding what Smilefast is all about and how it's different to other systems which are out there, but that doesn't mean they're right. So I look forward to seeing you at one of our courses. Thank you very much. Have a wonderful evening. Good night.